So thank you for the introduction. My name is Christina Kim. I am one of the vascular neurologists at UT Houston. And today I'll be talking about tips for staying healthy and preventing stroke. So the objectives for today include talking about the basics of stroke or Stroke 101, and then tips for staying healthy and preventing stroke. So May is Stroke Awareness Month, and we're nearing the end at this point. So that's why I wanted to go over some of the basics, like what is a stroke, different stroke types, the impact of stroke, how to recognize a stroke, and why it's important to go seek medical attention immediately after you suspect a stroke. So to start, what is a stroke? So a stroke occurs when a blood vessel bringing blood and oxygen to the brain, retina, or spinal cord gets blocked by a clot or ruptures. When this happens, brain cells don't get the blood and oxygen that they need to survive. This causes nerve cells to stop working and die within minutes. Then the part of the body that uh, the brain controls gets affected. So the effects of stroke may be permanent depending on how many cells die, where they are in the central nervous system, and other factors. So what are the different stroke types? So the main stroke type is called ischemic stroke. It accounts for about 87% of all strokes. Ischemic stroke occurs when a blood vessel supplying blood to the brain, again, is obstructed or blocked. A rarer type of ischemic stroke is called venous infarction, and that's due to occlusion of a cerebral vein or venous sinuses. Ischemic stroke accounts for the majority of stroke cases that are potentially treatable if timely medical attention is received. There are several causes of ischemic strokes like carotid artery stenosis, small vessel disease, or cardioembolism. As many as 35% of patients will have unidentified causes for their stroke. Hemorrhagic strokes are less common, making up about 13% of stroke cases. They're caused by a weakened vessel that ruptures and bleeds into the surrounding brain. The blood accumulates and can compress the surrounding brain tissue. The two types of hemorrhagic strokes include intracerebral, or within the brain hemorrhage, and subarachnoid hemorrhage, which occurs between the surface of the brain and the skull. Intracerebral hemorrhages are commonly caused by uncontrolled blood pressure, aging blood vessels, or sometimes from underlying vascular abnormalities like arteriovenous malformations or AVMs. Subarachnoid hemorrhages more commonly occur when an aneurysm ruptures. And lastly, TIA, or transient ischemic attack. A transient ischemic attack is not a stroke, but more commonly known as a mini stroke or a warning stroke. TIAs occur when a blood clot blocks an artery for only a short period of time. Unlike a stroke, when a TIA is over, there is no permanent injury to the brain, and imaging in the form of things like MRIs are negative for stroke. Similarly, the symptoms from a TIA resolve in a short time, usually less than 24 hours. A common cause of TIAs include development of fatty deposits lining the vessel walls, which is a condition called atherosclerosis. As the name warning stroke suggests, after having a TIA, you are at a higher risk for developing ischemic stroke, and the risk is highest in the first 3 months following a TIA. So the impact of all stroke types is very significant here in the US and globally. In the US alone, 9 to 10 million adults have experienced a stroke. And each year, 600,000 residents have a first stroke, and 200,000 will have a recurrent stroke. Nearly 160,000 people will die because of stroke, making it the 5th leading cause of death. Globally, on average, 1 in 4 people are affected by stroke in their lifetime, and it is the 2nd leading cause of death and 3rd leading cause of disability in adults worldwide. So who gets affected? As suspected, it is usually older individuals with a prevalence approaching 7% in persons greater than 60 years old and 14% in those that are greater than 80 years old. By 2050, it's estimated that the prevalence of stroke will have likely increased by nearly 66% when compared to 2020. Despite encouraging data about declining stroke incidence overall, on a global level, the aging population and accumulating risk factors contribute to an increasing lifetime risk of stroke. Further, progress has been less pronounced among younger individuals, and such trends have underlined the importance of focusing on the primary prevention of stroke. Elevated risk in young individuals can be related to several factors, including genetic factors from inherited conditions, social factors that relate to healthcare access, and biological factors related to sex-specific risks or hormones. For example, endometriosis is a female-specific risk factor for stroke. Endometriosis is a chronic gynecologic condition, and it's usually diagnosed in the reproductive years and has been associated with cardiovascular risk factors, including stroke. Also, premature ovarian failure, which can occur before 40 years of age, and early onset menopause before 45 years of age are also associated with an increased risk for stroke. Therefore, screening for all three of these conditions is a reasonable step in the evaluation and management of vascular risk factors in these individuals to reduce stroke risk. So next we'll talk about how to recognize a stroke. So there are many possible presentations of stroke because any part of the brain, retina in your eye, or spinal cord can be affected by stroke. The acronym BFAST is an easy way to remember how to spot a stroke fast. B stands for balance. Is there a sudden loss of balance or coordination? E stands for eyes. Is there sudden double or blurred vision or sudden trouble seeing that persists? F stands for face. Ask the person to smile. Is one or both sides drooping? A stands for arms. Ask the person to raise both arms. Does one side drift downward? Or is there weakness or numbness on one side? S stands for speech. Does the person have slurred, garbled speech, or are they someone that you don't understand? Can they repeat a simple phrase? T stands for time. If you observe any of these signs, it's recommended to call 911 immediately and note the time when symptoms began. Other stroke symptoms not mentioned in the BFAST acronym include things like sudden onset of confusion and sudden severe headache. The common presenting feature of stroke symptoms, as you might have seen, is that the tempo of onset of symptoms is usually sudden. So why act fast? You should act fast because every second delayed in seeking medical attention or decision making has a big impact on the brain. For every second during a stroke, 32,000 brain cells are lost, which is the equivalent of 8.7 hours of brain aging. For every minute that therapy is delayed in the typical stroke, 2 million more brain cells die. And for every 10 minutes that therapy is delayed, one less patient of every 100 experiences a benefit from treatment. It is therefore very important to seek immediate attention if you suspect a stroke in yourself or a loved one, especially since substantial advances in therapy have occurred in the past 10 years, particularly for acute stroke treatment. The first line of acute stroke treatment includes IV thrombolysis. Clot-busting drugs like alteplase and tenecteplase break down fibrin in the blood to restore blood flow. For the best outcome, patients must present within 4.5 hours of the last time they were seen without stroke symptoms, with an ideal treatment time being less than 60 minutes from the onset of symptoms, which is also referred to as the golden hour for stroke treatment. Studies have demonstrated that treatment with IV thrombolytics can lead to improved functional outcomes and reduced disability at 3 months. However, not everyone is a candidate for IV thrombolysis. Contraindications include things like hemorrhagic stroke, use of certain blood thinners, severe uncontrolled hypertension, and recent stroke or surgery. In regards to types of IV thrombolytics, alteplase or TPA used to be the sole agent approved by the FDA for treating acute ischemic stroke until this year when the FDA granted approval for tenecteplase or TNK. TNK is a genetically modified variant of TPA, and it has emerged as an alternative to TPA with comparable efficacy and safety. Operational benefits, such as one single bolus administration and lower costs, have prompted consideration or implementation of system-wide transitions from TPA to TNK across the US. Endovascular therapy is another type of mechanical reperfusion therapy. The FDA approved the first intra-arterial thrombectomy device for clot removal in patients with acute stroke in 2004. 5 trials published in 2015 established endovascular thrombectomy as one of the most powerful treatments to reduce disability in any specialty of medicine. Not everyone is a candidate for this as well. Eligible patients include those who have an occlusion in a large vessel of their brain, or sometimes a medium vessel. Using advanced CT imaging and sometimes MRI, stroke centers have the capability to thread tiny catheters into the arteries of the brain to remove the clots causing strokes. Endovascular therapy should ideally be done within 6 hours of the onset of acute stroke symptoms, or up to 24 hours under certain conditions. This can be done for some patients who arrive too late for IV thrombolysis or may have contraindications for IV thrombolysis. It can also be used in conjunction with IV thrombolysis in certain cases. So for the second half of this presentation, we'll be discussing tips for staying healthy and preventing the strokes that we just learned about. We will use the American Heart Association's Life's Essential 8 as a framework to discuss how you can optimize a few behaviors and take advantage of evidence-based preventive care to stay healthy and prevent all forms of cardiovascular disease, as well as stroke. So to move towards a stroke-free life, we first need to bridge the gap between the present state of control for stroke risk factors among US residents and the control that we would like to achieve with better implementation of available proven care strategies. This gap is often called the prevention gap. Life's Essential 8 serves as a bridge, implementing known strategies to address several modifiable types of risk factors through behavior and pharmacology changes. Using these strategies and guidelines, more than half of stroke events could be prevented, along with associated disability and cognitive decline. The Life's Essential 8 strategies are as follows. 1. Manage blood pressure. 2. Manage cholesterol. 3. Manage blood sugars. 4. Manage weight. 5. Quit tobacco. 6. Eat better. 7. Be more active. And 8. Get healthy sleep. So we'll break these down into 2 basic categories. First, vascular risk factors that typically respond to behavioral changes or a combination of behavior change and pharmacology. And the second category will be risk factors that respond mostly to behavioral changes. So number 1, manage blood pressure. Approximately 46% of US adults have hypertension or elevated blood pressure, so it is the most potent and modifiable risk factor for stroke, both ischemic and hemorrhagic. The impact is that for every 10-point reduction in systolic blood pressure, which is the top number in your blood pressure, And for every 5-point reduction in the diastolic blood pressure, which is the bottom half of your blood pressure reading, reduces the risk of stroke by 41%. Therefore, it is recommended that all adults be screened for hypertension. And a goal blood pressure to have is less than 130/80. So in order to manage your blood pressure, the following behavioral or lifestyle changes are recommended. 1, invest in a blood pressure device and keep a blood pressure log at home. 2, eat smart. For example, lower your sodium, saturated and trans fats, and sugar intake. One recommended diet is the DASH diet, which encourages reducing sodium intake to less than 2,300 milligrams per day and emphasizes fruits, vegetables, whole grains, and lean protein while limiting fats, sodium, and added sugars. Increased intake of potassium is also indicated in the U.S. dietary guidelines for Americans to lower blood pressure. Third, move more. We will talk about exercise a little bit more later in this presentation, but for now, just know that it is recommended to keep active in any form, since it has been shown that short durations of exercise seem to be just as beneficial as longer ones, even 10-minute bouts of exercise. And resistance exercise training has shown to lower blood pressure in particular. For example, weightlifting, leg and bicep curls, squats, and things like that. 4, manage your weight. If you are overweight, even a slight weight loss can reduce high blood pressure. 5, no nicotine. Every time you smoke, vape, or use tobacco or nicotine patches, the nicotine can cause a temporary increase in your blood pressure. And last, 6, sleep well, at least 8 hours of sleep. When behavioral and lifestyle changes are not enough to lower the blood pressure, pharmacologic therapy is recommended. Randomized controlled trials have demonstrated that treatment with one blood pressure medication is effective for reaching the blood pressure goal in only 30% of participants, and that the majority of participants achieved the goal with 2 or 3 medications. Therefore, greater than or equal to 2 antihypertensive medications are recommended for primary stroke prevention in most patients who require pharmacologic treatment of hypertension. So moving on to number 2, control cholesterol. It is important to control cholesterol because elevated cholesterol can lead to increased stroke risk by contributing to plaque buildup or atherosclerosis in your blood vessels. As you may know, cholesterol is a fat-like substance that comes from 2 sources: your body, the liver, and food. The cholesterol is broken down into 2 basic types, good and bad. Bad cholesterol includes your LDL and is associated with increased risk of ischemic stroke. Lipoprotein A is also a form of LDL that is a known risk factor for atherosclerosis. A recent meta-analysis found that lipoprotein A was significantly associated with risk of ischemic stroke and large artery atherosclerosis, for example, in your carotid arteries. Good cholesterol refers to high-density lipoprotein, or HDL. HDL helps to keep LDL, the bad cholesterol, from sticking to artery walls and reduces plaque buildup. Low HDL is inversely associated with the risk of ischemic stroke, so it's better to keep your HDL high. Goals for primary prevention of stroke are to aim for an LDL level less than 100. For secondary stroke prevention, meaning if you've had a stroke previously, our goals are to keep your LDL less than 70. The impact of controlling cholesterol is that for every 1 unit reduction in LDL, the risk of first stroke is reduced by about 21%. For behavioral changes to control cholesterol, it is recommended to eat smart with foods that include lots of fiber, like vegetables, fruits, and whole grains, and to replace saturated fats like butter and whole dairy to healthy fats like olive oil, fatty fish, nuts, and eggs. You should also move more and avoid nicotine as it lowers your good cholesterol or your HDL. In regards to pharmacologic therapy for primary prevention, cholesterol management requires attention to cardiovascular risk factors beginning early in life. The most recent ACC and AHA guidelines risk stratify based on several factors, including your age, your 10-year cardiovascular risk scores, and other risk enhancers like family history of premature cardiovascular disease. The higher the estimated risk, the more likely you are to benefit from cholesterol-lowering treatment. For patients greater than 75 years of age, assessment of risk status should be discussed between the patient and their doctor on an individual level. For those recommended to start pharmacotherapy, it is recommended to start with a statin. If, despite statin therapy, or if statin is not tolerated, it is recommended to add ezetimibe or Zetia next. The next class of lipid-lowering agents include PCSK9 inhibitors, like Repatha, and lastly, bempedoic acid, like Nexletol. For elevated triglyceride levels greater than 135, it is recommended to add icosapent ethyl, like Vascepa. There has been no benefit found for omega-3 fatty acid supplementation for stroke risk reduction. So moving on to the third essential life factor, which is manage blood sugar. Most of the food we eat is broken down into glucose to give us energy. Glucose enters your bloodstream after food is digested and travels to cells throughout the body. For glucose to enter cells and provide energy properly, it needs a hormone called insulin. The pancreas is responsible for producing this insulin in the right amounts. In people who have type 1 diabetes, the pancreas does not make insulin. In people who have type 2 diabetes, the pancreas makes too little insulin, or the body does not use insulin in the right way, called insulin resistance. As a result, people with untreated diabetes accumulate too much glucose in their blood, and their cells don't receive enough energy. Over time, excessive blood glucose can result in increased fatty deposits or clots in blood vessels. These clots can narrow or block blood vessels in the brain or neck, cutting off blood supply. And this stops oxygen from getting to the brain and causing a stroke. Diabetes affects about 1 in every 10 people in the US, or about 38 million people in the US currently. And this risk factor doubles the risk for stroke. In adults with diabetes, higher cumulative hyperglycemia or high sugar levels are associated with higher stroke risk, with a 12% higher risk of stroke per 1% increase in hemoglobin A1C. Hemoglobin A1C is an indicator of glycemic level over 2 or 3 months and is checked through the blood. Therefore, for all adults who are overweight, obese, or have atherosclerotic cardiovascular disease, screening for prediabetes and diabetes is recommended by checking a hemoglobin A1C. The goal A1C for prevention is less than 7% for those with diabetes and less than 6.5% for those with prediabetes. So behavioral changes that could help manage your blood pressure include eating smart again, limit sugary foods and drinks, increase water intake to maintain healthy blood sugar levels, and speak to a nutritionist about a diabetic diet if you have diabetes. As with the other vascular risk factors mentioned earlier, it is also recommended for those with diabetes to move more, manage weight, and avoid nicotine. When behavioral changes alone are not enough, pharmacologic therapy is recommended, and metformin is the first-line pharmacologic therapy to improve glycemic control. If your A1C remains elevated after lifestyle changes and metformin, and you have other cardiovascular risk factors, consideration can be given to newer therapies like SGLT2 inhibitors and GLP-1R agonists. And further questions regarding these newer therapies should be discussed individually with your primary care physician or endocrinologist if it is appropriate for you. Moving on to number 4, healthy weight. A healthy weight helps your brain and heart function better. One way to measure your weight is through your body mass index, or BMI, which relates your weight to your height. An optimal BMI is less than 25. The greater the BMI, the higher the risk of fatal stroke overall, as well as ischemic and hemorrhagic stroke. A goal for achieving healthy weight is to set initial weight loss targets of 5 to 10%, which have a clinically significant impact on cardiovascular disease risk. In overweight or obese adults, a 5% weight loss can lead to a reduction in blood pressure of approximately 2 to 3 points. A 11 to 17-pound weight loss leads to bad cholesterol or LDL reductions of approximately 5 units and increases in your good cholesterol of 2 to 3 units. Weight loss can also reduce your risk of diabetes, improve your mobility, and improve your mental health. Recommended behavioral changes to achieve a healthy weight include eating smart. Tips for eating smart for weight loss includes portion size, reading food labels for nutrition and calorie content, as well as learning what a serving size is, and as well as adding protein to your diet to help you feel full for longer. You should also move more, as eating too many calories and not being active enough can lead to weight gain. When these behavioral changes for achieving healthy weight are not enough, sometimes pharmacologic therapy is recommended. The US FDA has approved several medications for weight loss, including semaglutides like Wegovy and tirzepatides like Zepbound. But recent meta-analysis provide strong evidence for pharmacologic treatments for diabetes that lower both blood glucose and weight, like these GLP-1R agonists that we just mentioned, as well as bariatric surgery procedures in individuals with class 2 or 3 obesity, with or without diabetes, and who have, and it helps to reduce risk of cardiovascular events, including stroke. Within the scope of healthy weight, abdominal obesity should be considered. This is defined as a waist circumference of greater than 40 inches in men and greater than 35 inches in women. The impact is that for every 0.01 increase in waist to hip ratio, there is a 5% increase in your risk of cardiovascular disease. The American Heart Association therefore recommends annual measurement of your waist circumference in addition to your BMI, especially in non-white race and ethnicities, to improve cardiovascular risk assessment. Number 5, quit tobacco. Use of inhaled nicotine delivery products, which include traditional cigarettes, e-cigarettes, and vaping, is the leading cause of preventable death in the US, and it includes about a third of all deaths from heart disease. Smoking contributes to 12 to 14% of all stroke deaths as well. It is never too late to quit smoking. Smokers who quit after a cardiovascular event have better outcomes than those who continue to smoke, with health benefits that begin almost immediately. In those who quit, the risk of a recurrent event is the same as a non-smoker within 3 years. However, it is important to note it is not helpful to just decrease how much you smoke, because smoking reduction has shown to have little effect on clinical or biologic markers, confirming that even minor exposure to tobacco smoke is harmful and illustrates the importance of complete smoking cessation. Behavioral changes recommended to quit tobacco include things like telling yourself to wait for 10 to 15 minutes when you have the urge to smoke, as cravings can sometimes pass in a short amount of time. Keep your hands and mouth busy. For example, chew gum or drink water, or find a stress ball to squeeze. You should also recognize what triggers that make you smoke. For example, certain places or social situations can trigger the desire to smoke, so try to avoid them. And lastly, get a buddy system or support group to help you quit. Smoking cessation pharmacologic therapy combined with behavioral counseling is superior to behavioral interventions alone. Some of the pharmacotherapy options include things like Chantix, bupropion, and nicotine replacement therapy. Next, we'll talk about eating better. So think long term and create a healthy eating pattern that you can realistically maintain, which focuses on whole foods, lots of fruits and veggies, lean protein, nuts, and seeds. It is helpful to make these changes by shopping for your own groceries, meal planning, and cooking at home. When shopping, read again nutrition labels and look for the heart healthy check marks, which make it easier to know what might be a good item to eat. Read what is considered a serving size. At home, adjust the portion size and make a balanced plate. It is helpful to divide your plate as pictured, with half of your plate consisting of vegetables and fruits. Half of your fruits and vegetables are typically free of trans fats, saturated fats, and sodium, and they tend to be low in calories. They also fill you up thanks to its fiber content and water, and that can help you manage your weight. All forms of fruit and vegetables, whether they're fresh, frozen, canned, or dried, can be part of a healthy diet. They are among the most versatile, convenient, and affordable foods you can eat. Choose those with little or no added sodium or added sugar. And while meal planning, look to include a variety of colorful fruits and vegetables, which usually provide various nutrients, vitamins, and minerals. The other half of your plate should be split between lean proteins and whole grain. Another method to eat better is the Mediterranean diet, which is recommended by the American Heart Association and American Stroke Association. The Mediterranean diet is not as much a diet as it is a way of life. For hundreds of years, people in Italy, Spain, and other countries in the Mediterranean region have been eating this way. Compared to a typical American diet, the Mediterranean diet includes fewer meats and carbohydrates, higher amounts of monounsaturated or good fats, and more plant-based foods like vegetables, whole grains, peas, beans, lentils, and nuts. And research has shown that Mediterranean diet interventions may reduce the risk of stroke by approximately 35% when compared to placebo-controlled diets. In considering eating better and prevention of stroke, I wanted to take a moment to talk about something called the gut-brain connection. The brain and gut microbiome, which is the ecosystem of microbes or bacteria that live in your intestines, are intimately connected. The microbiome supports your body's immune system and produces chemicals that affect brain function. Certain gut bacteria convert fiber from the food we eat into compounds that have anti-inflammatory properties. And this is important because as we age, the bacteria living in our gut change as well. The population of bacteria tends to become less diverse, meaning there are fewer types of bacteria. And this loss of diversity can make room for opportunistic bacteria, often associated with illness, to move in. In the case of stroke, within hours of onset, the gut barrier becomes leaky, and this allows very bad bacteria in the gut to circulate throughout the body and can cause serious infections. Therefore, maintaining a healthy gut microbiome can help maintain a healthy brain. Eating foods rich in prebiotics and probiotics help to keep our gut-brain connection healthy. Prebiotic foods like oats or bananas contain non-digestible fibers that microbes in your gut can break down and use. Think of prebiotics as healthy food for the microbes in your gut. Probiotic foods contain live, active microorganisms, and those include things like yogurts, kefir, sauerkraut, and kimchi. Moving on to number 7, be active. Sedentary time has increased over the past 2 decades in the US, particularly in the young, raising the importance of characterizing its effects on long-term health. It has been found that adults in the US spend on average greater than 7 hours a day in sedentary activities, possibly related to increased use of devices like phones and computers. A sedentary lifestyle is associated with several adverse health effects, including an increased risk of stroke. Physically active men and women generally have a 25 to 30% lower risk of stroke or mortality than the least active. Most successful lifestyle interventions for weight loss require participation in a program, either individually or in a group, for greater than or equal to 6 months. Specific goals to have include engaging in greater than or equal to 150 minutes per week of moderate intensity exercise, like walking fast, or 75 minutes per week of vigorous intensity exercise, like running, or an equivalent combination of moderate and vigorous intensity aerobic exercise. Kids should also have at least 60 minutes of activity every day, including play and structured activities. Next, we'll talk about getting healthy sleep. Most adults need 7 to 9 hours of sleep each night, and children, depending on their age, will need even more sleep. Adequate sleep promotes healing, improves brain function, mood, and reduces the risk for chronic diseases. Some tips for getting healthy sleep include things like dimming the lights before sleep to help signal your brain that it is time to wind down. Dim your screen or use a red filter app at night. The bright blue light of most devices can mess with your internal clock and melatonin production, a hormone that regulates sleep. You can also set an alarm at the same time every day to go to bed and to wake up. This helps regulate your body's internal clock and makes it easier to fall asleep and wake up naturally. You should also create a bedtime routine, spending 20 to 30 minutes every night winding down before bed and doing activities such as reading, meditating, or taking a warm bath. Again, avoid screens. And lastly, block it, meaning put your phone on Do Not Disturb if possible to block out interruptions to your sleep. Lastly, consider a sleep study if you have risk factors for sleep apnea. Obstructive sleep apnea is the most common post-stroke sleep disorder, with about 65% of stroke survivors having some degree of sleep apnea. Recurrent episodes of obstruction of the upper airway during sleep, resulting in paused or shallow breathing, characterize sleep apnea. Sleep apnea also increases stroke risk through its indirect effects on hypertension and AFib. Treatment with something like CPAP could reduce stroke risk. So the take-home messages that I would like you to take from this presentation are the following 6 items. Number 1, screen and manage vascular risk factors like high blood pressure, which is the most potent and modifiable risk factor for stroke. Number 2, eat better, incorporating a change in your diet like the Mediterranean diet that you can easily maintain. 3, be more active. Some physical activity is better than none, and adults who participate in any amount of physical activity gain health benefits. 4, get healthy sleep, at least 8 hours a night. 5, be fast. Keep in mind that there are many presentations of stroke and seek immediate medical attention if there is any question, because time is brain. Thank you very much.